Hi guys, this is Max and welcome back to my channel. Today we have a case of extreme hyperlordosis and possibly a lower cross syndrome and upper cross syndrome. So that means really tight lower back and really tight upper back and extensor of the neck. So she complained of having problem in the lower back and feeling a little tight on the neck. Today I'm going to show you how I'm going to treat this complaint. Right now I'm just sliding on the tissue, try to feel where the knots are. It's still not a deep work, it's a preparation work for what is going to come after. I noticed that the left part is a little tighter. The trap, all the rotatory cuff. So I'm just warm it up slowly and go deeper. If you follow this channel because you relax watching the video, I will try to use my voice to make you go in a state of relaxation while you're listening and learning. And the more you watch, the more you learn. The more you learn, the more you can practice better. I stole this technique from Dalton, a great massage therapist. And a good way to treat the rhomboid is helping yourself with the use of the pulling and pushing at the same time. A classical technique that comes from Thai massage, allow you to go deeper into the rhomboid and under the scapula. Right now I'm working on the infraspinoso. It's still a preparation, as you can see. And do some fast trigger point to control that the tejido, that the tissue is not too tight. She's complaining about it, you can tell. She feels a lot of tension. It's a classical trigger point. It's a classical point of pain. Again, I don't like to do a strong work or a too strong work. I don't think pain is necessary when you do a massage. Sometimes a little pain, it's good, but too much, it's actually make the tissue become tenser. I like sitting on a table. I think the more you relax as a massage therapist, the more you can actually give a great massage, because allow you to pass this good relaxing energy to the client. It's something I learned doing Brima, a kind of a Thai massage where you exchange Thai massage and meditation, where you exchange energy and massage with another person. This technique is great. I think the stretching and the work on the traps in that position is really effective in relaxing and allow the tissue to really blend and melt in your hand. So again, a classical stroke and a slow, deep, relaxing stroke all the way down to the trap. So the more you relax, the more the client is relaxed. I always, if I'm by myself shooting, always controlling that you can see what I'm doing. This is a great way to work all the muscle close to the spine, and using active release technique with the use of the arm. So that was a great way to release the lower trap. If the lower trap is tight, I'm sure the upper trap is tight. And most of the time, if the lower trap is weak, the upper trap is tight. Yeah, we are going on the other side. Of course, the work will be much longer, but it's massage is already relaxing. Sometimes boring to watch. I'm aware of that, so I need to move from one side to the other to show as many techniques as possible and maintain at the same time the pleasure for the client. So again, from another angle, you can see how comfortable is this way of working. It's a little intimate, I think, but if you know the client, if for example is somebody that comes really often, I think there is no reason to be shy of using the technique. So now I'm working on the rotatory cuff. She noticed a lot. She noticed a lot of pain, and because of the posture. See again, this is a stretching. It's actually work the trap. But at the same time, you can even grab the supraspinoso. Yeah, she's feeling it. Yeah, it's like there was a muscle. It was like a hooked. Yeah, working the infraspinatus, the teres major and minor. Really important, especially in lower cross syndrome, in the upper cross syndrome problem. Again, this long, slow fascia release all the way to the lower back. Then working the extensor of the back. Yeah, she feel a lot of pain at that point. Extensor of the back, multifido, and probably the QL. It's really tight. I really like this technique, starting from the sacrum all the way to the occiput. It's one of my favorite techniques and one of the favorite technique for the client. They really enjoy that moment where they can kind of predict where your finger is going to go. And again, some work on the lower traps and the teres minor. External rotator that can create a lot of problem. Again, some technique from Twina, actually. That was a Twina technique. And now, for the lower back, what I'm about to do is really important for try to relax the multifido and the QL. I'm using the leg to create some movement in the vertebra, in the lumbar of in the vertebra, and that allow me to move and work on a tight knot in the same time. See, I'm asking the client to move in the opposite direction while I'm pressing in the other direction. That's you got to really watch out when you use this technique, because if the lower back is too strong, I will not use this. Any technique when there's the lower back, when you have a really back pain, it's not suggested to push too much. So if you see video where people push too much in this lumbar, I think you got to be aware that you can make it worse, because it's already tight if you have a back pain, and you don't want to make it tighter. It's something I learned with time and with practice. You want your client to be happy and to come back. So if you give extra pain, it's true that after 2-3 days the pain goes away, but if you can obtain that without giving that extra pain, you can really have a lot of recurrent clients. Again, sliding deeper and deeper into the para. Yeah. To the paravertebral muscle all the way. It's always nice to, after you do some deep work, give a rub to your client. Yeah. You will just notice that was super, super tight, and not probably calcium into the reticuloplasmaticum of the cell. Yeah. Well, she's probably right now. She feels more relaxed. Actually, this voiceover is been a week after I did the video. She was really happy with the work we did. It's a classical elbow work from Thai. I like to mix technique. I think it's the best massage is where you can mix technique and create the best blend, the best freestyle for your client to make it the more comfortable as possible and the more effective as possible. And now again, spreading, go deep. That's right. Yeah, it's called deep tissue for a reason, because you go deep into the tissue. Yeah, that's the spreading of the fascia is in that manner. It's related to the spiral line of Michael Myers' anatomy train. You know, we got spiral line in the front and in the back. You got to be able to turn one side, other side, and twist your back. So if that's tight, that's not gonna be 100% perfect. Again, working the triceps, working the rotatory cuff, giving some rub. And then opening the lower back, create some traction in the sacrum. This is just the first part why I'm going to work this. Then it's going to be the second part when I'm going to work the glutes and the sacrum and the lower cross syndrome. Yeah, I'm just showing off. I'm going to try some technique. I always like to try new position when I massage my client, trying to see if I can find new ways and experiment with position. It's like a martial art. It's like a jiu-jitsu for massage therapists. Learning if you can move and give a good therapeutic massage in different positions. Less boring, more creative, and more effective. Again, trying to work the extensor of the lower back, especially the QL, where the attachment is. Yeah, that's enough for today. I hope you like this video and subscribe, and see you soon. Thank you very much. Bye.